Sorry, I will address some for fertility as well as breastfeeding and introducing gluten to young infants. And then we'll also talk about two health concerns that are really common for women, which includes bone health and iron deficiency anemia. So again, if you have any questions, you're welcome to type them into the chat box. So as Dr. Crowe was saying, that there might be some malnutrition factors that do affect fertility. And aside from celiac disease, a healthy body weight does play a role in fertility. Both underweight and overweight decreases fertility rates. And this is because the production of female reproductive hormones are affected by weight. They're decreased when someone is underweight, especially if they have secondary amenorrhea where they lose their period. Sometimes ovulation can not occur even if a period is still occurring, so bleeding is not necessarily a sign of fertility. And then in overweight individuals, sometimes overproduction of estrogen is a factor, as well as insulin insensitivity. So if someone has some form of, pre-diabetic or type 2 diabetes, they may suffer from infertility. A couple other nutritional factors would be inadequate fat intake, especially monounsaturated fats, because fetuses and babies really need a good energy intake, as well as inadequate protein intake. Growing a baby requires a lot of protein, so those are both really important in conceiving. A couple other nutrients that I'll add to Dr. Crowe's, what Dr. Crowe mentioned, that are really important in fertility. Folic acid, I'm sure most of us have heard about this and the role that it plays in preventing spinal defects in fetuses, but just in conceiving as well and producing new cells, folic acid is necessary. Calcium levels and iron levels are really important in those women who are pregnant. Their needs are higher when they're pregnant. Zinc levels are really important for fertility and ovulation, so making sure that there's not a zinc deficiency and making sure that intake is adequate when trying to conceive and when pregnant. Omega-3 fatty acids, specifically for the DHA, which is a specific fatty acid that's really important in brain development, is really essential while pregnant, as well as the nutrient choline, which is not something that is talked about as much, but that's really important to get for development of baby. One reason why a lot of these nutrients are deficient in the gluten-free diet, which would affect someone with celiac disease or someone who eats gluten-free for other reasons, is because a lot of gluten-free products still are not fortified or enriched. So if you notice, here's a generic cereal, a type of Cheerios. You can see how the whole breadth of vitamins that are added in, specifically to help those Americans who may have inadequate intake of these nutrients. Whereas on the left, we have literally no vitamin or nutrient content in this gluten-free cereal. The only nutrients really are energy that you're getting from this cereal. So this is definitely changing, and more gluten-free products are being enriched and fortified, but I would say it's still not adequate. And so replacing a gluten-free diet for a gluten-containing diet might not always be equal nutritionally. So where can we get some of these fertility foods? Folic acid is prevalent in beans especially, and leafy greens, and as well as in whole grains. So you would need to choose naturally gluten-free whole grains. Zinc is really prevalent in nuts, and you can also find it in meat and shellfish. Choline is mostly found in animal sources, so we have your egg yolks. Pork and cod are also really high. And then the vegetable that contains the most choline is cauliflower. And then DHA, you can really only get from fatty fish, or you can take a fish oil supplement. Okay, so let's move through the progression of fertility and during breastfeeding, which is usually recommended whenever possible by dietitians because it naturally helps with postpartum depression, movement of the hips back to their original position, and stabilization of weight. So returning to a pre-pregnancy weight is helped just by breastfeeding. Calorie needs are actually about 500 calories higher just for producing breast milk. So if someone is breastfeeding, you need to be sure to get adequate energy. You might also have, breastfeeding women also have increased needs of several vitamins and minerals, including especially calcium, magnesium, and iron. We're going to talk about bone health a little bit later, but I did want to mention that women actually lose 3 to 5% of their bone mass during breastfeeding because of the high calcium output. But it does usually recover after weaning. But that would be a concern of someone who maybe has frequent pregnancies and is frequently breastfeeding. So breastfeeding in celiac mothers could be impaired, especially if, I guess primarily if someone is undiagnosed or if they have a low body weight. So production of breast milk is actually lower in those women who have a lower than normal body weight. And because of this, their infants may be more likely to experience failure to thrive. I can only speculate, but I'm not sure if that played any role in the lower breastfeeding time in the study that Dr. Crowe mentioned. She said on average, that study showed about 2.5 months of breastfeeding. So just maintaining a healthy body weight and adequate intake can help with breastfeeding, breast milk production. There's been a couple studies recently about if breastfeeding is protective for celiac disease, for the development of celiac disease in the infants or the children of mothers or parents that have celiac disease. So really, the latest research shows that there's no strong link. There's not really any protective benefit that breastfeeding plays in the development of celiac disease. We know that breastfeeding is protective for many other conditions, but the latest data shows that at most it may delay the onset of celiac disease, but not prevent it for the lifetime. It doesn't have a role regardless of if a child is breastfed during gluten introduction or not. And that you can find more information by this study that's mentioned here. So just to assuage everyone's concerns, gluten is not passed through breast milk. There are other allergens that are passed through breast milk, and a lot of infants do have gastrointestinal symptoms, especially heartburn or colic, reflux, because their GI systems are very delicate. So other allergens in the food may pass through, but not gluten. Gluten is too large, so there's no need to be concerned about exposing an infant to gluten until they take solid foods. Formula usually does not contain gluten. I couldn't find any brands that contained gluten as I was looking. Not to say that you shouldn't check, but generally introduction of solid food is when the risk of celiac disease can begin in infants. The most recent research suggests that introducing gluten to infants at 6 months is the ideal time for decreasing the risk of disease. So in this study that's mentioned here, there were some groups of infants that had 2 sets, a double set of the DQ2 genes, and they were considered at higher risk for developing celiac disease. It seems that introducing gluten before 6 months or after 6 months would actually increase the risk of developing it in the first few years of life. So currently, there could be new research coming out all the time, but currently it's thought that 6 months is the ideal time for introducing gluten to infants. And I don't know why my slides are doing this. Sorry. Okay, so let's go ahead and talk about bone health because this is an issue that affects women more than men. Driving me nuts. Okay, so why are women special? Why does it affect women more often? Okay, so estrogen production is preventive of bone loss, actually. So once women are producing estrogen from their ovaries, starting in at the onset of periods or menstruation, up until the stopping of menstruation at menopause, it's protective from losing bone mass. But women who may not have adequate estrogen production could negatively affect their bone mass, and also just larger muscle mass increases bone density. So women typically have a lower muscle mass than men, which means that they generally have a lower bone density. So here's a chart showing kind of typical bone density for the different sexes. And you notice that females, their peak bone mass is definitely lower than males. And this is generally due to muscle mass and just overall mass. And then women start to lose bone mass sooner than men because of the onset of menopause, because the estrogen levels do drop during menopause. And when estrogen is not present in the body, there's more turnover of bone. So basically, more bone is broken down than is created. Bone is actually a living tissue. It seems like such a solid, permanent thing, but it's constantly being broken down and built up. So the different bone disorders include that often affect those with celiac disease include osteomalacia, which is soft bones, and is also known as rickets, usually in children. This is due to vitamin D deficiency, which is, like Dr. Crowe said, really common in the United States, not always to the extent of causing osteomalacia. But those who may have had a vitamin deficiency for years due to celiac disease are more likely to have osteomalacia. And this can cause bones to bend and even break. And it usually causes pain, so muscle weakness and really achy bones. The other bone disorders that I'm going to talk about, osteopenia and osteoporosis, are both due to the deterioration of existing bone tissue. So like I said, bones are continually being built and broken down, kind of similar to our muscle tissue. So if we have any source of malnutrition where we don't have adequate calcium or phosphorus, vitamin D or magnesium, we may not have the building blocks to rebuild the bone. And then also just naturally due to aging and menopause, more bone will be being broke down than built up. So this results in basically calcium being resorbed or taken out from bones, and this leads to low bone density. So there's less minerals in the bone, which means it's less dense. Osteopenia is, the first level of low bone density. It's a Z-score of -1 to -2.5 standard deviations below normal, and then osteoporosis applies to anyone who has a bone density of less than -2.5 standard deviations below normal. So here's a chart of how bone mineral density is distributed, and the peak in the center refers to normal. Anything about 1 standard deviation to either side is still considered normal. But below 1 to -2.5 is considered low bone mass or osteopenia, and then below that is osteoporosis. Here's just a few pictures that demonstrate the phenomenon. So on the left is osteomalacia, which leads to bending bones that can then break. And then on the right here we have a normal bone matrix versus osteoporosis. So you can see that, as the name implies, bones are more porous and they contain less of the material that's needed to provide the structure. Here's a graph that illustrates how bone is is formed initially, as we're growing, as we're children, bone is being formed at a really high rate, and to a lesser extent, it's being resorbed or broken down. But at some point later in life, the rate of resorption outpaces the rate of formation, and that's more distinct in women than in men. So bone mass or bone density is diagnosed by a DEXA bone scan, which everyone can, request or talk to their physician about having done. It's often recommended that there's no, definitive guidelines. It's often recommended that individuals are scanned at the time of diagnosis for celiac disease to see if there's any room for improvement, because low bone density can be treated. So it's important to catch it as early as possible to try to utilize, the time you have available to increase your bone mass. Your doctor might also decide to scan if you're complaining of bone pain. If you've ever had an eating disorder or other malnutrition for a long period of time, which could include celiac disease. If you had lost your period for any prolonged period of time, because during this time estrogen is not being produced, and that can negatively affect bone mass. When someone is postmenopausal, it's usually recommended to have a bone scan. And then certain drugs like chemotherapy, steroids, and radiation can affect bone density, so that your doctor might want to monitor it then, as well as especially with parathyroid disorders that can affect bone mass. So individuals who have celiac disease who also have a parathyroid disorder definitely need to be watched. I like to talk about, why do we care about bone health? Aside from motility and independence, because bone fractures and bone pain can really, negatively affect someone's independence or ability to get around or to be athletic and participate in activities. Just having the availability to move can also affect cardiovascular health, and actually infections can happen from undetected fractures. So sometimes a bone fracture is not obvious. It could be in the spine or in an area that's not obvious, and if it goes too long, it can actually become infected, and the infection can spread throughout the body, leading to sepsis. If it's not caught early enough, sometimes it needs to be amputated. So caring about bone health really affects your entire body. The specific nutrients that are important in bone health are especially calcium, vitamin D, and magnesium. And here are the recommended intakes. Calcium, I put 1,200 milligrams per day for those menstruating women. You'll find some places recommend 1,000 milligrams a day, which is also okay, but I recommend 1,200. And then 1,500 are needs for calcium increase when we're postmenopausal because of that increased bone breakdown. And your doctor might prescribe a higher dose of calcium if you are being treated for a bone disease. Vitamin D needs are about 600 international units per day, and it can be difficult to get vitamin D from food sources. We're going to talk about where you can get these nutrients. So a lot of people do take supplements when they have a deficiency, and usually over the counter you can treat it with 1,000 to 2,000 IUs per day, or your doctor can prescribe a medical dose that's even higher to help treat vitamin D deficiency. And then magnesium needs are 320 milligrams per day, but are actually higher in those women who are pregnant or lactating. So here's where we can get most of these nutrients. Definitely, I think we all have heard that dairy is good for bone health, but a lot of people with celiac disease may be lactose intolerant or have an additional dairy intolerance for other reasons. To not state the obvious, I want to go over some non-dairy sources of these foods, which aren't as well absorbed as they are from dairy, but you can definitely get good amounts from non-dairy sources. So vitamin D you can find in mushrooms, especially there's certain mushroom brands that have been specially kind of irradiated with light to increase their vitamin D content. You can find it a lot in fatty fish like herring, mackerel, salmon, and halibut. You can find lots of fortified sources of vitamin D because we're all very deficient in vitamin D, so there's a lot of fortification going on. Make sure that if you drink soy milk and not dairy, that it is fortified with vitamin D, or you can find orange juice that's fortified. And eggs, specifically the yolk, can be a good source of vitamin D. For magnesium, we have most things that are grown from the ground. So we have nuts, leafy greens, soy, and other beans and legumes are very good sources. And then calcium you can also find in beans, canned salmon or sardines that contain the bones actually are good sources of calcium, and that is because you are eating the bones. Leafy greens are a pretty good source, as well as seaweed, and then you can also find fortified orange juice or soy milk, as well as tofu. Here's just a great a suggestion for a bone health salad. To throw together some mixed greens, some roasted chickpeas, cashew nuts, some avocado for some healthy fat, roasted cauliflower, and some grilled tofu. You have a lot of kind of calcium, magnesium, and vitamin D rich foods in there. You can also add a piece of fish, some grilled salmon on top instead of the tofu to really increase your vitamin D intake. And then here's just a nice dressing recipe, and definitely I recommend using an acid like lemon juice to increase absorption of all of these minerals. There's some lifestyle interventions that can really help us with bone health. Weight-bearing activity is recommended to keep up bone mass about 30 minutes a day, several days a week, about 4 or 5 days a week. Weight-bearing activity includes anything that uses gravity, so it doesn't count swimming or trapeze, anything else you wouldn't do that contains gravity, but anything like walking, jogging, hiking, dancing, these are good weight-bearing activities that keep your bone mass high. I think a good demonstration of this is, I think of when astronauts go into outer space and they don't have the effect of gravity, they do lose a lot of bone and muscle mass. So that's just a good thing to think of. You can get your vitamin D definitely from sunshine or from a UV light. If you don't live in a place with much sunshine. Current recommendations are about 20 minutes a day without sunscreen. So definitely discuss this with your physician if you have any reason for not being out in the sun, but that can be a good way to get your vitamin D. Definitely limit alcohol. There's studies that show that women who drink more than 2 alcoholic beverages per day have a higher risk of osteoporosis. And then caffeine intake can also decrease bone density. It's not significant in those who aren't at risk or who, generally take in enough calcium. But for someone who has been diagnosed with osteopenia or osteoporosis, I would definitely monitor caffeine intake. Smoking is detrimental to bone density, and so is a high soda intake. So the last topic I want to talk about is iron deficiency anemia, which is actually the most common deficiency for women worldwide and is also the most common symptom for celiac disease in adults. So iron deficiency is really common. It often has really it goes undetected or untreated for a lot of women. I myself had iron deficiency anemia as one of my primary symptoms of celiac disease. It took several years to really get it under control. So I have a few kind of personal tips to offer as well. Iron deficiency anemia means that there's an inadequate number or an abnormal or two abnormal red blood cells. And red blood cells, circulate throughout the body to carry oxygen to our cells. So we really need to have adequate red blood cells and healthy red blood cells to make sure that we have energy. It can be diagnosed, it's usually diagnosed from either a low red blood cell count, low hematocrit, low hemoglobin, or low ferritin, which is the iron stores, can indicate iron deficiency. And the low hematocrit indicates that cells are smaller in size because they don't have adequate hemoglobin. The symptoms include fatigue, lethargy, irritability and depression, poor concentration or memory. Shortness of breath is really common, especially when doing physical activity. When it gets really severe, you might have brittle nails or spoon nails where they actually kind of curve up at the edges, pale skin, or pica, which is actually the desire or actual eating of ice or other non-food items like dirt. And then dizziness and lightheadedness is really common. So you can treat iron deficiency anemia just by increasing your intake of iron. Really good dietary sources are red meat and dark meat poultry like turkey, liver, if anyone out there likes to eat liver. Tofu and beans and pumpkin seeds are good sources of the non-heme iron, which means that it's from a plant source and it is less absorbable, it has to be converted to a heme source in our body to be used. So especially if someone's a vegetarian, you need to be mindful of getting adequate iron. If you're not vegetarian, you can always pair animal sources with plant sources to maximize the absorption of the plant sources. So actually just having red meat with your salad can increase the absorption of iron from that salad. Some other tips are to separate your iron intake from your calcium intake because they can actually bind together and prevent either from being absorbed. So definitely don't take your iron supplement with a glass of milk. Or, if you're being really mindful of trying to increase your iron intake, make sure that there's no dairy in that meal. You want to separate them by about 2 hours to prevent them from binding together. And always eat these sources with a source of vitamin C because that really increases and enhances absorption. Oral supplements are also a really good idea because dietary sources can take a long time to treat the deficiency. The supplement that's usually recommended is called iron sulfate or ferrous sulfate, and it tends to be pretty hard on the GI tract. So what I recommend is chelated iron, which is also specifically ferrous bisglycinate. And you usually don't find this in your local drugstore, but you can definitely find it online. And it's a much more absorbable, gentle on your GI tract form of iron. Causes a lot less of the abdominal cramping or constipation that can happen from iron supplements. So when I was taking this, I didn't notice any symptoms whatsoever. And then if for some reason you're still not responsive to, increasing iron in your diet or through supplements, go back to your doctor and find out if there's some other cause of malabsorption. Is there still hidden gluten in your diet? Is your TTG level back to normal? Have you had a second endoscopy that shows that your villi have healed? You might need to investigate a source of blood loss, especially for those who have co-occurring disorders like Crohn's disease or gastric ulcers, anything that might cause blood loss in the GI tract. And then bacterial overgrowth can actually continue to cause malabsorption. So I would definitely consider that as a cause, as well as certain medications. And then here's a just overall, I'm calling it the Women's Health Chili, and it's really easy. It only takes 30 minutes to make. Basically put all of these ingredients in a pan and a pot and let it simmer for about 20 minutes. I'm going to have the full recipe with directions available on the website after the webinar. Actually, it's up already. So you can find this at celiac.org/ask. And we'll also have this up with the recording of the webinar later. But this chili recipe I love because it contains a ton of iron, calcium, folic acid, magnesium, and vitamin C to help the absorption of all of these minerals. So if anyone has any questions, I will stay on the line for a few minutes. I do want to mention that our next webinar will be Wednesday, April 15th at 9 a.m. Pacific time. And this will be with Dr. Joseph Murray, who's also going to be speaking at the Celiac conference this year. So we're doing a great countdown to hype up the conference. You can find more information to sign up for the conference at celiac.org. And tune in to us next month to talk with Dr. Murray. Thanks so much, everyone.